There has been an attempt to create an AIDS-free generation with the World Health Organization, recommending strict guidelines surrounding testing and treatments. However, these guidelines have been proven difficult to follow in the country of Mozambique. I will demonstrate how governmentality, biopower, and structural violence have contributed to the epidemic of AIDS in Mozambique and impacted the attempt of eliminating the horrific disease in the country. Mozambique has the second highest morbidity rate in the world of HIV or AIDS. 2.2 million people have been diagnosed with HIV in Mozambique, and so they've been really impacted. Lack of support and resources, low retention and care, gender disparities, and the ongoing COVID-19 pandemic are amongst the reasons why rates of HIV infection have been difficult to lower in this African country. Governmentality is defined as the discipline given by institutional organizations. Rachel Chapman describes this going on in Mozambique in her paper written in 2020. Firstly, there has been major budget cuts to health and social services. This takes away the ability for healthcare workers to provide primary care as well as HIV and AIDS care. This includes prevention of drug prescriptions being filled or continuity of care or retention of care. Those have significantly dropped. Furthermore, aid from the U.S. are not going to the correct services such as AIDS prevention, and instead going to international non-governmental organizations. The COVID-19 pandemic has also impacted the budgeting as there's been lack of revenue. And these are all examples of governmentality as these factors lie outside of an individual's control, yet they affect the individual's ability to receive services, even if they want to receive them. So on to structural violence. Structural violence is defined by Paul Farmer as historically given and economically driven. This is seen as in Mozambique, especially in women. They're expected to navigate the healthcare world on top of all their other responsibilities, such as working or caring for their families. And if they stop doing those responsibilities, they risk an even greater food insecurity than they already face. It must seem almost impossible to stay on top of health appointments when health resources are so few and far between. There's also a significant stigma that comes with HIV-positive disclosure for women in Mozambique. They risk losing social support and status that tie in with gender expectations that have gone back for decades. Because of these reasons, 60% of women who tested positive for HIV and were initially receiving antiretroviral therapy, 60% of these women stopped treatment at every step. So there's been a heavy lack of care continuity. The circumstances that create these gender disparities include gender expectations, poverty, underfunded healthcare systems, and ineffective budgeting, all of which will relate back to structural violence. The UNAIDS has set the goal of 90% of those who are tested positive for HIV to receive antiretroviral therapy, and 90% of those on antiretroviral therapy reaching viral suppression by 2020. Furthermore, the World Health Organization recommends a very strict guideline of treatment. However, what these institutions fail to realize is that these guidelines are very difficult to follow by people of Mozambique because their reality does not line up with these goals. Biopower is defined by Foucault as an internalized self-disciplinary that responsible citizens impose on their bodies and psyches as a moral responsibility. However, there are factors at play that prevent Mozambique citizens from imposing such a responsibility on themselves, such as social and financial factors. Therefore, citizens of Mozambique have much less biopower than citizens of other countries. The citizens of Mozambique are experiencing a horrible epidemic of HIV and AIDS. While the disease can be blamed on a virus, the social and cultural processes contributing to the epidemic cannot be ignored. The men and women of the country cannot simply be told to get tested and continue the treatments because their current reality does not allow for that to occur on a consistent basis. Economic and social aspects that have been going on for years must be considered to gain a complete understanding of the governmentality, structural violence, and lack of biopower that is happening within Mozambique. Only once all these factors are considered will any progress be made in the fight against HIV and AIDS.